If your creatinine is high, someone has probably told you, just drink more water. Your kidneys will become normal. Maybe you are forcing yourself to drink 4 or 5 liters daily. Maybe you feel guilty if you do not finish a big bottle of water. But here is the real question. Can drinking more water actually cure kidney disease, or can too much water sometimes make things worse? This video is very important for you because many patients delay proper treatment, thinking water alone will fix the problem. Our kidneys are natural filters. They clean waste from blood, they balance water and salt in the body. When they are damaged, their filtering power reduces. This reduced function is called kidney disease. Doctors often check a blood test called creatinine. Creatinine is a waste product. If it increases, it can mean the kidneys are not filtering properly. Now let us focus on water, because water is both helpful and misunderstood. When the body is dehydrated, kidneys receive less blood flow. Creatinine can temporarily rise. In this situation, drinking adequate water helps. Kidney function may improve. In kidney stones, good hydration reduces stone formation. In mild urinary infection, fluids help flush bacteria. But this does not mean water can repair permanently damaged kidney filters inside each kidney. There are millions of tiny filters. These are called nephrons. You can think of them like very small strainers. If these strainers are scarred, water cannot make them new again. Now let us understand what happens. If someone with kidney disease keeps drinking excessive water daily, first possibility is fluid overload. When kidneys cannot remove extra water efficiently, the fluid stays inside the body. It collects in legs. It causes swelling in feet. It can cause puffiness around eyes. If fluid keeps increasing, it can enter the lungs. This causes breathlessness, especially while lying down. Some patients wake up at night gasping for air. Second problem is low sodium level. Sodium is a mineral in the blood. It helps control brain and muscle function. If someone drinks large amounts of water quickly, sodium level can become diluted. This condition is called low sodium. Low sodium can cause headache, nausea, confusion. In severe cases, it can cause seizures and even coma. Third issue is unnecessary stress on the heart. Excess fluid increases blood volume. Heart has to pump harder. In patients with weak heart function, this can worsen heart failure symptoms. Fourth issue is false reassurance. When patients believe water is treatment, they may ignore blood pressure control, they may skip medicines, they may delay proper medical evaluation. Another important point is laboratory confusion. If a patient drinks very large amounts of water before blood test, creatinine may appear slightly lower, but this does not mean kidneys are healed. It only reflects temporary dilution. The underlying damage remains. Now, let us talk about what is reasonable hydration. If kidney function is normal and there is no heart problem, drinking according to thirst is usually safe. In hot climates or heavy exercise, more fluids are needed. If someone has stable chronic kidney disease, fluid intake should not be extreme. It should not be forced. There is no benefit in drinking 4 to 5 liters without reason. For many people, 2 to 2.5 liters per day is adequate, but this can vary depending on climate and body size. Another common mistake is forcing water at night. This disturbs sleep, causes frequent urination, and affects quality of life. Now let us correct some common myths clearly. Myth 1. More water can wash away kidney damage. This is not true. Water supports normal function, but it does not reverse scarring. Myth 2. If creatinine is high, just increase water and it will normalize. Only dehydration-related rise improves with fluids. Chronic damage does not reverse like this. Myth 3. If water is good, more water must be better. In medicine, more is not always better. Balance is important. So what is the final message? Water is essential for life. Water helps kidneys work properly, but water is not a cure for chronic kidney disease. The real protection comes from controlling blood pressure, controlling blood sugar, reducing salt intake, taking prescribed medicines regularly, and having regular follow-up tests. If this video helped clear your confusion, please like this video. It helps spread correct medical information. Subscribe for weekly education on kidney, urinary bladder, and prostate health. Comment below your questions or tell me which topic you want next, and share this video with someone who believes drinking more water alone can cure kidney disease. Take care of your kidneys wisely and always choose balanced and informed decisions.